If you've been thinking about skipping leg day, your knees are asking you to reconsider. Welcome to today's Muscle Monday. We're going to talk about the quad muscles today. Your quads consist of 4 different muscles. You have your rectus femoris, which runs from the bony prominence on your hip right here down and joins the tendon down at the bottom. All 4 of these muscles are going to join the quadriceps tendon, which is the tendon that goes and connects to your kneecap or your patella, and then runs down and it switches to your patellar tendon or ligament, depending on what source you look at, below the kneecap to attach to the shin bone or the tibia. But so that rectus femoris is the longest one. It starts up here and it attaches at the ASIS, the bony prominence here. And then you have the vastus medialis, which is if you flex those quads and you see that bump on the inside of your leg, that's the vastus medialis. You have the vastus lateralis, and then you have the vastus intermedius, which is the one that's in the middle. All of those muscles come together and form that quadriceps tendon I was talking about earlier, and those are the 4 muscles that make up your quad. Functionally, these muscles are really important for knee extension, so a kicking motion, if you're gonna extend that knee all the way, that's the main motion of these muscles. They also play a role that rectus femoris crosses the hip joint, so that actually plays a role in hip flexion, bringing that knee up. And then they're very important for stabilizing, for walking, and for swinging through with your gait. Clinically, there's a couple different things I see with this in here. So you can actually get a tendonitis or tendinosis in that quadriceps tendon. A lot of times you'll get a lot of aching right at the top of the kneecap after exercise, or if you've had a long day using your legs and you're like, man, it's just achy there. That's signs of quadriceps tendonitis, so you need to start addressing that with some stuff we'll talk about in the Thursday video. The other thing that the quadriceps play a really big role in is they help with patellar tracking. So they make sure that that kneecap is moving properly through the groove in the femur that it moves in, and that if there is some imbalance in the quadriceps or some weakness, that can cause some of the knee issues there as well. The last thing I want to note clinically is that quadriceps strength plays a really big role in osteoarthritis of the knee. That's one of the first things anybody who's rehabbing somebody with osteoarthritis for the knee. Also, it's a really important thing to work on getting active again after an ACL repair. Those are the clinical things that you find with this muscle. Quick little anatomy overview, and then I'll see you on Thursday and we'll talk about some ways that we'll treat it.